Good morning, everybody. It's Dr. Noha Polak from Progressive Pediatrics, Union City in Bayonne, New Jersey. And today's topic is about, today we're having an update on what's happening now with COVID, especially in children. So I am a pediatrician practicing in Union City in Bayonne for the last 24 years. I'd like you to know that I am on top of all of the new ongoings with COVID. I do not listen to the news. I have to agree with you that the news are a little anxiety provoking. So what I do spend a lot of my time doing is attending video conferences with the American Academy of Pediatrics, with the CDC. On a weekly basis, we attend several of them just to keep up to date as to what the new things are. So as of yesterday, the CDC said that about 30% of people out there have had some sort of symptom, have had 30% of people who have been exposed to COVID have no symptoms. So 30%, okay, well, we'll see how that works out. But again, they said this is a new number. So I wanted to discuss this multi-system inflammatory syndrome in children. So it's multi-system inflammatory syndrome in children that's been all over the news. So here's what's known about this symptoms. Here's what's known about this condition so far, okay? Multi-system inflammatory condition in children so far. The bottom line with it is that it does happen 2 to 6 weeks after exposure to COVID. The children often feel fine before, and then they get a high fever. Usually the temperature is around 38 degrees C, which is 100.4 degrees Fahrenheit. They're under 21 years of age. The majority, about 3/4 of these kids, are school age, not infants and toddlers. They usually have, 100% of them will have fever, and usually they also have vomiting, diarrhea, abdominal pain. Some will have rashes, and some will have other symptoms. So what do you as a parent needs to know? When do you contact us, and when do you go to a hospital? The bottom line is, if your child has had a fever above 100.4 degrees Fahrenheit, which is 38 degrees C, and is having abdominal pain, vomiting, or diarrhea, you should call us. We're going to take a look at your child virtually, and we're going to ask you several more questions, and we may ask you to do a few things, such as take the child's temperature in front of us if possible. And we're going to want to take a look at their entire body to see if there's any rashes. We're going to ask you to press on their belly and see what happens. We're going to ask you, we're going to ask the child how severe the abdominal pain is, and then we're going to direct you to the right place to get the right care for your child. Because again, children's hospitals are equipped to deal with this for children, and other hospitals may not be so equipped. All right, so next question is, if my child has a fever, should I get a COVID test? If your child has a fever and has been exposed to anyone with COVID, yes, you should and can get a COVID test. In our area, there are several places where you can get COVID tests, and you get the next day, the results have been coming the very next day, which is really reassuring now. So there's a place in Union City, there's a place in Hoboken. If you don't know where to go, you can't find it online, give us a call. We'll do our best to help direct you to the one closest to you. So most of these kids don't even have fever. They just have fever. I'm sorry, they don't even have cough. They just have fever. They have a red tongue, and they have conjunctivitis sometimes, which is, redness in the eyes. So conjunctivitis alone from allergies does not mean they have this syndrome. It just means they have allergies. So if there's no fever, don't panic. Okay. So what else do I want you to know about this? Not a whole lot. I would order a bunch of tests if I could, but I'm probably going to send you to the hospital. Thank you.